every second person will develop cancer in their lifetime.
One out of every 2 men and 1 out of every 3 women will be diagnosed with cancer. But despite those huge numbers, most individuals don't know what that really means.
The questions that cancer poses us are not easy to answer. They are about life, death, faith, love, and so much more.
The challenges faced by the standard forms of cancer treatment. Hypoxia in solid tumors is not only a major problem for radiation therapy, but also leads to resistance to most anti-cancer drugs and, importantly, appears to accelerate malignant progression and increased metastasis.
Healthy cells in certain parts of the body are especially sensitive to chemotherapy drugs, making some symptoms more common. For example, loss of healthy cells in your bone marrow can cause you to develop an infection, and loss of healthy cells in the digestive system can cause you to feel nausea.
One of the main reasons for cancer chemoresistance is increased patient drug tolerance due to increase in cellular drug excretion of the chemotherapeutic drugs. Furthermore, chemotherapeutic drugs are generally not specific for particular cancers. They affect only cells that divide. Dormant cancer stem cells are generally not affected by chemotherapy. The photon energy can cause damage to the tissues as the beams travel towards the targeted tumor. If the remaining energy of the beam is not fully absorbed by the tumor, it can continue to pass through and damage more healthy cells until it exits the patient's body. The apparent solution seems to be combination therapy. Investigating combination therapy for combating cancer resistance is currently of great interest in the clinical setting. Over the past decades, the struggle against cancer has led to the discovery of new strategies to fight these shortfalls and to bring hope to the patients.
Pretty much everybody gets some level of tiredness, and most people, because the radiation has to go through the skin, could get some level of skin irritation.
These new strategies include hypothermia, also known as thermal therapy or thermotherapy. Hypothermia is one of the few strategies to be adopted as a promising therapy among the alternative methods to treat cancer.
Interesting thing about hyperthermia, it's one of the oldest treatments there is for cancer treatments, and way back in the 30s and 40s, what they do is they would put people in chambers and they basically would heat them up, because one of the things cancer cells don't like is heat.
Heat can kill cancer cells when it's given in combination with radiation, and even chemotherapy is more effective.
Give me the power to create a fever and I shall cure any disease. Those famous words spoken 2,000 years ago by Hippocrates, the founder of Western medicine.
Research has shown that high temperatures can damage and kill cancer cells, usually with minimal injury to normal tissue.
Dr. Nilay Datta speaks about one of his patients who was 75 years of age and could not take chemotherapy for a sarcoma.
Only protons and hypothermia. There's no chemotherapy and, if possible, no surgery.
Other oncologists wanted to amputate his knee. Dr. Datta said no. After hypothermia therapy,
And the patient is walking in front of you, no crutch. He is going for ski. What else do you want? You don't want anything else.
Therapy group had a complete response of 38%. With hypothermia, it increased to 60%.
The history of hypothermia dates back to the days of Siddha, Ayurveda, Greek, and Chinese medicines, which was prevalent in this country thousands of years ago. Introducing Remission 1 degree, which is nothing but a technological advancement of the ancient concept of hypothermia.
We, Adipo Labs Company, has been pursuing health and happy life of mankind. ISA's company with medical expertise that has played a leading role in the development and manufacture of personal medical household appliances. From obesity treatment equipment using high-frequency to high-frequency hyperthermia treatment equipment with original technology, and we have been researching and developing Remission 1 degree. high-frequency hyperthermia cancer treatment and continuously try to lead a healthy and happy life, which is the biggest hope of mankind, out of the suffering of disease. What is the high-frequency hyperthermia treatment? It is a treatment method that is effective for various cancer treatment as a principle that generates deep heat through high frequency in cancer cell tissue in the deep part without any physical damage. In particular, Remission 1 Degree, developed by Iahom Labs, is as a high-frequency hyperthermia cancer treatment equipment approved by Korean Ministry of Food and Drug Safety. It is stage 4 cancer treatment method that the world is paying attention by immunotherapy, which treats cancer by raise the body temperature of our body through deep heat and increase the number of natural killer immune cells, and by principle, which necrotize the more sensitive cancer cell at heat than normal cells. Remission 1 Degree, a high-frequency hyperthermia cancer treatment equipment developed by Iahom Labs, is a treatment method using high-frequency alternating current, which apply an electric current to the human body between two electrodes. When a high frequency is applied to the human body, the bipolar molecules, ions, and electrons in the body have vibratory motion according to the polarity that changes 460 times per second. And as a result, collision and rotation occur between the molecules and generated the frictional heat in the deep part of the human body. When heat is generated in the deep part of the body, as the temperature in the body rises, leukocytes and metabolic enzymes are activated, metabolism becomes active, and all cell and organs function becomes smoothly. Malignant tumors invade surrounding tissues and are transferred to other organs and required high levels of metabolism. However, when heat is generated through deep heat, cancer cells fail to release heat at high temperature and begin to necrotize by thrombus. Hyperthermia treatment is based on the fact that cancer cells reach the lethal temperature more quickly than normal cells. In addition, if NK immune cells activated by Remission 1 Degree high-frequency heat are found in cancer cell, it will inject with perforin according to kind of cancer and environment, and dissolve cytoplasm and inject apoptosis, moisture and ions, etc., which induce cancer cell suicide, and cancer is suppressed through necrosis, which causes cancer cells to expand and necrotize. On September 22, 2017, the Remission 1 Degree special seminar was held by Research Institute of Biomedical and Biotechnology at Sault Ste. Mary's Hospital of the Catholic University on the theme of the effect of hyperthermia on cancer treatment. In addition, clinical paper of the Korean Society for Thermal Medicine and related cancer scholars are being announced with one after another. The high-frequency hyperthermia cancer treatment equipment Remission 1 Degree has been proving the efficacy of hyperthermia treatment and immunotherapy through cancer patients. In the future, from the viewpoint of cancer treatment as well as immunotherapy, it will have result with profound impact on the healthcare and healthcare industry in an aging society. Remission 1 Degree Special Seminar of Korean Society for Thermal Medicine became an opportunity for active research on hyperthermia and immunotherapy with experience of deep heat generation of high-frequency hyperthermia treatment equipment and paper presentation. On May 12, 2018, we signed MOU agreement with United World Halal Development, President Mohammed Jinnah at the Lotte Tower in Seoul, to export Remission 1 Degree, a high-frequency hyperthermia treatment equipment for medical devices, to India, the Middle East, and Southeast Asia. Iahom Labs, company that thinks health of mankind top priority, is making a new standard of health and happiness as a leader in medical industry, such as obesity, pain, and cancer treatment using high frequency. The technology evolution of Iahom Labs, recognized by leading domestic and foreign cancer specialists and medical institutions, will continue in the future.
ட்ரீட்மெண்ட் இப்போ நல்லபடியாக போயிட்டு இருக்கு. ஃப்ரம் த பிகினிங்ல இருந்த விட இப்போ ஐ ஃபீல் பெட்டர் நவ். 2-3 monthsக்கு முன்னாடி ஐ வாஸ் கெட்டிங் ட்ரீட்மெண்ட் இன் ஹாஸ்பிட்டல். அப்போ வந்து இந்த அவங்க சர்ஜரி தான் சஜஸ்ட் பண்ணியிருந்தாங்க. ஸோ என் மைண்டில் வந்து சர்ஜரி போகிறதுக்கு மைண்ட் செட்டு யோசனையிலே இருந்துச்சு. ஹைப்போதெர்மியாவை பற்றி கூகுள் பண்ணி பார்த்தேன். அதுக்கப்புறமா வந்து எனக்கு மனசில் வந்து சரி இது மாதிரி பண்ணலாம் அப்படின்றத தோணுச்சு. அதை பேஸ் பண்ணி தான் நான் இந்த ஹாஸ்பிட்டலில் சூஸ் பண்ணேன். இப்போ ஆல்மோஸ்ட் சூஸ் பண்ணது வந்து ஒரு நல்ல சாய்ஸ் அப்படின்ற மாதிரி என் மனசுக்கு தோணுது. ஹைப்போதெர்மியா எடுக்கிறதுக்கு முன்னாடி வந்து டோட்டலி, அதாவது கீமோ எனக்கு ஃபஸ்ட்டு விஎஸ் ஹாஸ்பிட்டலில் கொடுத்து கீமோ கொடுத்ததுனால வந்து டோட்டலி வீக்காக இருந்தேன். ஸோ ஹைப்போதெர்மியா பண்ணும்போது இந்த டியூமருடைய லெவல் கம்மியாச்சு. முன்னை விட பெட்டராக இருக்கேன் இப்போ. நான் ஃபீல் பெட்டர் இருந்தோம்.